My name's Wilsey, and I'm here to talk to you about Parkinson's disease.
Hi, I'm Olivia Wilsey. I'm Katie.
I'm Sawyer. I'm John. I'm William. I'm Conrad.
And these are my audience members. They pertain to my speech topic because they are friends of mine or a family member who knows my grandpa. So guys, how would you feel if your body suddenly froze? What if your hands or legs began to shake all the time? Can you imagine not being able to smell a rose or your favorite food? Unfortunately, these are common everyday things that people with Parkinson's disease have to deal with. According to the Parkinson's Disease Foundation website, every year, 50,000 to 60,000 people are diagnosed with this disease in the United States alone. Currently, there are 1 million people having to battle this cruel disease in the U.S. Unfortunately, there is no definitive known cause or cure. Parkinson's is a devastating disease which presents conspicuous symptoms requiring specialized treatment strategies. These place a significant burden on the patient and a massive responsibility on his or her caregiver. Parkinson's disease is also known as a shaking palsy. It is caused by inefficiencies in a part of the brain called the substantia nigra. Per the Neuroscientifically Challenged website, the substantia nigra is located in the mid part of the brain. This area produces little to no chemical known as dopamine. Without your brain making this chemical, it creates an imbalance, later diagnosed as Parkinson's disease. Some of the first symptoms that are presented before being diagnosed with Parkinson's disease includes hand, feet, or leg tremor, stiff muscles, stooped posture, difficulty walking, fatigue, poor balance, anxiety, impaired voice, and distorted sense of smell. Before being diagnosed with this disease, doctors examine your body and run many tests. The doctors then must assume you have Parkinson's disease when you meet the majority of the criteria in which Parkinson's disease patients tend to have. The symptoms differ in each person with Parkinson's disease, and responses to treatments differ as well. Parkinson's disease progresses at different rates among those affected. The longer someone is diagnosed with this cruel disease, the symptoms can become worse. Certain medications can reduce many of these symptoms, but again, there's no cure. To help manage the symptoms of poor balance, tremors, and stiff muscles, most of the medications for Parkinson's replace or increase the dopamine that the brain cannot stimulate on its own. In addition to a dopamine promoter, other medications that are prescribed to patients may include antidepressants, cognition-enhancing medication, and an anti-tremor medication. This disease can also be treated with a deep brain stimulation surgery. Exercise certainly helps manage some of the symptoms as well. Patients with Parkinson's disease usually have a shorter lifespan than those who do not. According to the Parkinson's Disease Foundation website, on average, patients that are diagnosed with Parkinson's disease tend to live 10 to 20 years after diagnosis. Do you know someone who has Parkinson's disease? I do. Parkinson's is a struggle for my grandfather, Dr. Bob Wilson. He was diagnosed 14 years ago by a neurologist at the local hospital. At the time, his main symptom was a tremor of the left thumb and the loss of smell many years before. He went to Duke Medical Center Movement Disorders Clinic and continues treatment there and locally at the Veterans Administration Hospital. He has participated in several clinical trials that a cure may be discovered in the future. He takes several medications, some of which have been mentioned in this presentation. Yet tremors still affect his whole body. My interest in Parkinson's arose from my grandfather's diagnosis and ongoing struggle with this disease. The people in my audience are my friends who know my granddad and understand Parkinson's disease. While research was necessary for my presentation, I was able to gather much information by speaking with someone who has this cruel disease. A first-hand account of someone I love makes this disease so much more real, easier to understand, and hard to witness. In conclusion, Parkinson's is a devastating disease with no cure. It presents symptoms that require specialized treatment strategies, and it places a significant burden and responsibility on the patient and his or her caregiver. Though Parkinson's disease remains incurable at this time, there is still great hope. Yes, I have hope.